Bismillahirrahmanirrahim. My name is Dr. Mustaqim Shah, and in this lecture we will be talking about anemia. Well, anemia is decrease in hemoglobin concentration below the reference range. Well, the reference range is 13 to 18 gram per liter in male and 12 to 16 gram per deciliter in female. If we express this value in a liter, it will become 130 to 180 gram per liter in male and 120 to 160 gram per liter in female. But remember, this value changes a little bit by 0.5, so don't confuse yourself, just remember these values. The symptoms will include headache, fatigue, nausea and vomiting due to decrease concentration of oxygen in these tissues. The signs will include pallor, that is the color of the skin will be yellow, tachycardia, the heart rate will increases, and there will be systolic flow murmur. The systolic flow murmur occur because the cardiac output and the blood plasma concentration and the blood volume increases to compensate for the decreased hemoglobin concentration. So due to increased blood volume, the systolic flow murmur occur. There is also a chance of high output cardiac failure. Rarely retinal hemorrhage can occur and chylonychia can occur. In the investigation, we do the full blood count and see for the red blood cell concentration, the hemoglobin concentration, the total leukocyte count and the platelets count. Then further we do the peripheral blood smear to look for the shape of the RBCs and to look whether it is a megaloblastic anemia, hypochromic or microcytic anemia, or it is normocytic anemia. We also do the serum iron, the total iron binding capacity, and the serum ferritin. The serum ferritin is the stored form of iron, while the serum iron is the iron that is present in the blood. If the serum iron is decreased, the total iron binding capacity will increase. We also do serum B12 and folate for megaloblastic anemia. Further, we can also do bone marrow aspiration and routine biopsy to look for the iron stores and to look whether there is the infiltration of the bone has occurred or not. So, what are the various types of anemia? The microcytic hypochromic anemia, the normocytic and the megaloblastic anemia are the three main types of anemias. In microcytic anemia, the MCV, mean corpuscular volume, decreases to less than 80. So anemia with low MCV, it is anemia with low MCV that is less than 80. The causes include thalassemia, anemia of chronic disease, iron deficiency anemia, lead poisoning, and sideroblastic anemia. Remember this by the acronym of TAILS. TAILS. T for thalassemia, A for iron deficiency, for anemia of chronic disease, I for iron deficiency anemia, L for lead poisoning, and S for sideroblastic anemia. What is iron deficiency anemia? So iron deficiency anemia occur when the stores of iron decreases in the body. This may be due to either GI or genitourinary loss. If blood is losing from the body, like from the gastrointestinal tract or from the genitourinary tract, then of course the iron deficiency anemia will occur. In young and elder individuals, it may be due to worm infestations which consume the human blood and the iron deficiency occur. In some individual, it may be due to nutritional deficiency when a person is taking less iron in the food, like in poor countries or poor individual with a lower socioeconomic status. Nutritional deficiency can occur. The iron deficiency anemia can occur due to increased demand, like in pregnancy. In pregnancy, the demand of the body for the mother as well as for the fetus increases, so iron deficiency anemia can occur. It can also occur due to decreased absorption, like celiac disease, or like due to malabsorption syndromes. In the investigation, we do the blood film. On the blood film, we will see the hypochromic microcytic RBCs. The MCV, mean corpuscular volume, will be low. The mean corpuscular hemoglobin concentration and the mean corpuscular hemoglobin will be low. The serum ferritin will decreases. Of course, it is iron deficiency anemia, so the ferritin will decrease. If the ferritin decreases, the serum iron decreases. And if the serum iron decreases, of course, the iron binding capacity increases to compensate for that decreased iron. We can also do upper and lower GI endoscopy to look for whether there is any bleeding from the upper or lower gastrointestinal tract. In the treatment, we give oral ferrous sulfate or gluconate. These are the two forms of iron that we give, either ferrous palm or gluconate palm. We can also give iron in the injectable form, in the iron sorbitol form. And most important, we should treat the underlying cause. Like if there is worm infestation, we should treat that. If there is nutritious deficiency, we should assess that. And we should assess the underlying causes. So this was all about the anemia and microcytic hypochromic and especially iron deficiency anemia. I hope you would have enjoyed this lecture. If you have enjoyed this lecture, please give it a thumb up and subscribe to the channel. Thank you.